very pleased to have Mara Udelman, who is the chair of the commission, as well as senior attorney at the National Health Law Program. Mara has been a very long-time advocate for the rights of individuals to receive healthcare services in a language that they can understand. She's done a great deal of policy work and advocacy work through the National Health Law Program, and in doing so has become something of an expert on professional medical interpretation. And it's in her capacity as the chair of the Certification Commission that she has been able to work on the project of advancing a certification program. So I'm going to just clarify a few things on the technical side of things before I turn stuff over to Mara. I just want to tell you a little bit about how we're going to handle Q&A for the webinar. As with all of our webinars, because we have such a large number of participants, the audience is muted at all times, but you can submit questions at any time. Just use the question window at the bottom of your control panel. And in this case, you don't have to indicate if you want your question to go to a particular speaker because Mara is the main attraction today. Now, to ask your questions, to send it in, as I said, please enter it into the questions pane. We will undoubtedly get more questions that we will have time to answer during the webinar, but it's our practice to hang on to all of the questions that we receive and then to send those on to the presenter afterwards, who will then take some time and try to answer as many more as possible. Now, another thing that can sometimes happen if you're new to GoToWebinar, you have a control panel, which is in the top right-hand corner of your computer screen. What you want to do is just click on the option that says View in the drop-down menu, and make sure that Auto Hide the control panel is not checked. This will enable you to see the question window and to see other details in the control panel throughout the webinar. Otherwise, it will automatically disappear on you, and then you might get a little disconcerted because you can't find it. So I'm now going to turn things over to Mara, and she'll talk for during her presentation, and then she will be available to answer questions. Thanks very much, Mara. And go ahead. The floor is yours.
Great, and thank you so much, and thank you to all of you who are participating today. And I'd especially like to thank the folks at Your Voice, Candice and Julia and others, for inviting me to present today. It's really, truly been a pleasure working with them, and I look forward to their conference next month. And it really has just been a wonderful experience being able to serve as the initial chair of the Certification Commission for Healthcare Interpreters, which I'll be calling CCHI for short. Because of some of the audio difficulties, I also am saying next slide so that we can advance the slides as well. So the next slide, please. Many of you know that there have been conversations for 20-plus years about the need to develop some core competencies for healthcare interpreters. And CCHI was formed solely to develop a competency-based certification program to focus solely on healthcare interpreters. Next slide. And we were launched actually exactly 1 year ago today, so I'll say happy birthday to CCHI, to answer these 20 years of conversations. And we wanted to develop a national, valid, credible, and vendor-neutral certification program that could be utilized as a determination of competency for healthcare interpreters and could be looked to by employers, contractors, agencies, and policymakers as a way to ensure the competency of language services provided. CCHI was created by interpreters for interpreters. More than half of our commissioners are practicing interpreters, and together the CCHI commissioners have over 200 combined years of experience working to improve language access and serving as healthcare interpreters. We also involve all of the other stakeholders in the healthcare arena in the development of our program. And what I'm going to do today is primarily walk you through who CCHI is, who we work with, what our mission is, what our goals are, and the steps that we've taken in the last year to develop our program. So again, we have a core base of 13 commissioners, but we also are involving a wider array of stakeholders in our work, and we literally have involved thousands of people in the development of our certification program to date. Next slide. On this slide, you'll see the list of the 13 CCHI commissioners, many of whom are nationally, whoops, we can go back to the slide of CCHI commissioners, many of whom are nationally recognized for their work in advancing language access, in serving as healthcare interpreters and serving on national commissions, national organizations, etc. As I said, 7 of us are practicing interpreters. We also include folks who represent and work in hospital settings, community-based organizations, academic settings that are involved in the training of healthcare interpreters, and nonprofit organizations as well. We also include a number of individuals who work with some of the vendors of language services. Next slide. We also have created 2 advisory panels to work with CCHI in the development of our certification programs. So the first group are folks who represent the broader array of stakeholders for whom certification and credentials for healthcare interpreters can form a benchmark for determining the competency of healthcare interpreters. As you can see, this is sort of the alphabet soup, and I do admit that I live and work inside the Beltway in Washington, D.C., so we're very attached to all of our acronyms here. But if you try to spell out all these folks' organizations, it doesn't fit nicely on one slide. But just to highlight a couple of the folks who are working with us as policy advisors include representatives from the American Public Health Association, the American Hospital Association, the National Association of Public Hospitals, the National Hispanic Medical Association, American Medical Association, and National Committee for Quality Assurance, as well as Guadalupe Pacheco, who many folks know works at the Federal Office of Minority Health and has really been a leader in developing the class standards and doing other amazing work at OMH on improving language access and cultural competency. In addition to folks representing the broader stakeholders in the healthcare arena, we also have invited to participate with us experts in the development of other certification programs for interpreters and in healthcare. So we have folks representing the National Center for State Courts, the Registry of Interpreters for the Deaf, and one of our commissioners actually comes to us from the American Translators Association. We felt very strongly that we could work with these folks and learn from what their vast years of experience, and also work with folks who develop healthcare certifications for other allied health professions, again, to learn from them and to really work together, because ultimately one thing that often comes out of certification is the recognition of an actual profession of individuals who will obtain credentials. So next slide, please. In addition to this really vast group of advisors, we also have a number of organizations who have come on as supporters of CCHI. And again, we really feel that this shows the depth and breadth of CCHI's work in ensuring that all of the voices important to developing a valid and credible certification program are in the process. And all of these folks are listed on our website, as well as our commissioners and our advisors. And we encourage you to take a look at our website and also to read everyone's bios and see really the vast experience that folks who are working with and in CCHI bring to the table. Next slide, please. So why are we actually talking about certification, and what are some of the benefits of certification? Well, many employers and healthcare providers see certification as a way to fulfill the standards of accreditation. Many of you are probably familiar that the Joint Commission just recently issued some new standards for hospitals on patient-centered care, effective communication, and language access. One of those standards talks about the requirement to ensure that staff providing services are competent. Now, the new Joint Commission standards do not require certification, but one way that a hospital could document that its staff are indeed competent and that their competency has been assessed is to document that its interpreters have proceeded through a credentialing program. A second benefit of certification is to help facilitate the management of interpreter services. When you have an independent, nonprofit, third-party organization conducting competency assessments, it will relieve the burdens on many healthcare providers for developing their own in-house training and assessment systems. One of the other benefits is the consistency of practices and procedures across the healthcare field. Again, right now we sort of have many healthcare providers who have developed their own training and assessment programs. It makes it very difficult for interpreters who may move from state to state or even from one facility to another to bring with them adequate documentation showing that they have the skills that a new employer may look for. When you actually have national standards, it will be much easier for an employer or an agency to assess the competency of an interpreter, and also it should make it easier for interpreters to be able to document that they have the requisite knowledge, skills, and abilities it takes to be an effective and competent healthcare interpreter. And then finally, certification and credentialing can serve the needs of individual interpreters who want a way to distinguish themselves and document that they have been through a competency-based assessment program that shows that they actually have the skills needed to be an effective healthcare interpreter. So next slide, please. As I said, CCHI was formed 1 year ago, and we have a vision and long-term goals for really working on developing the appropriate competency-based assessments for healthcare interpreters. Initially, our first examination is targeted at an entry-level healthcare interpreter, and I'll give you some more background on that later. As we move forward and as the profession becomes greater recognized, we may see the need to develop either specializations or levels of interpreting. You can imagine, for example, that there might be one examination for an entry-level healthcare interpreter, and then as we proceed, you might see a need for an intermediate or advanced healthcare interpreter. There may also be a need to have specializations such as interpreters with particular skills in mental health interpreting or end-of-life or complex case interpreting. We are administering our exam for the first time this fall, and folks who participate in that first administration or pilot examination and who pass the exam will receive the credential that they've applied for. So next slide, please. When we launched as part of our mission, CCHI was committed to developing a national, valid, credible, and vendor-neutral certification program. And these 4 terms really underlie all that CCHI has been doing in its year and is committed to continuing to do. And so I want to walk through what we mean when we say each of these terms. Excuse me. When we say that this is national, the certification and credentialing exams will be available nationally to interpreters across the country. This doesn't mean that it becomes mandatory. In fact, CCHI has no authority or ability to require individual interpreters to become certified or to take our examinations. Rather, we will offer it nationally, and we believe that as the profession continues to develop, you will see more and more folks want to participate in this program. The second term is valid. And this really is the single most important concept that underlies everything that CCHI does. We have undertaken the development of our certification program by following all of the best practices and industry standards in the certification industry. There actually is an organization out there that will accredit certification programs. And since our beginning, we have been looking at their standards and hiring vendors to work with us who have vast experience in complying with those standards and working with clients who ultimately can achieve accreditation for their certification program. In addition, we have a second consultant on staff on retainer with CCHI whose sole role with CCHI is to ensure our compliance with these national standards. So she oversees all the work of the CCHI commissioners, of our subject matter experts who are working with us, our test development companies, to make sure that we are following all of the standards that need to be followed in order to develop a valid and then ultimately credible certification program. And when we say credible, again, this goes back to who is working with CCHI and who is involved. And as I said, we literally have had thousands of interpreters, trainers of interpreters, supervisors, and healthcare providers work with us in the development of this process. And we feel that that really is critical because ultimately the certification program is for the good of the field. And by having the largest amount of participation possible, it really can only support the work that we're doing. The fourth term that we use throughout all of our work is vendor neutral. And what this means for CCHI is that we are starting the development of the certification program from the ground up. We have not taken any existing training program, assessment program, test, or other examination from anyone and called it certification. We also are not licensing any exam or part of an exam from another company. Rather, CCHI has raised the funds and developed this test following all the accreditation standards and has done it independently with vendors experienced in developing certification programs. While we have vendors of language services participating with us, and some of them as our commissioners, none of them has any ability to control what CCHI does. They don't get to determine who's on the board, how decisions are made, And furthermore, no one on CCHI has any financial stake in our outcome. All of the work that CCHI produces is owned by CCHI and redounds to the benefit of the interpreters who participate in our process. Next slide. I do want to explain a little bit about the differences between certification and certificates, because I feel that because this is a newly emerging profession, even though folks have been interpreting for hundreds and literally thousands of years, at least in the United States, there's some conception about what certification entails. And so I want to start at the bottom of this slide with the certificate of attendance or certificate of participation. Many interpreters in the U.S. have participated in some basic healthcare interpreter training programs. There's often a 40-hour class or a 60-hour class. And interpreters who complete those programs often get a certificate of attendance or a certificate of completion. What has happened in this field is that that certificate has been taken as being certification, when it really does not document anything other than that someone sat in the class for the requisite number of hours. A certificate of attendance or participation has no way of assessing the knowledge, skills, and abilities that someone may have attained in that class. Beyond a certificate of attendance or participation, there's a certificate of knowledge. And a certificate of knowledge is usually based on an examination that can demonstrate a narrow scope of specialized knowledge. This does not assess all of the skills and abilities that are required to perform a job, but rather some of the knowledge or skills or abilities. Finally, if you actually want to develop a valid and credible certification program, it needs to be competency-based. And it needs to be based on valid data that defines what the profession of interpreting, well, for us, what the profession of interpreting in healthcare is right now. And it must accurately test all of the knowledge, skills, and abilities that are required to perform that job. So what CCHI is currently doing is we have a competency-based certification program for Spanish interpreters. And we will be offering a certificate of knowledge for interpreters in all other languages. And what I'll do in the next couple of slides is walk you through what the differences are and where we're going to be heading over the next couple months. So next slide, please. This slide outlines a timeline of all of the steps that are required to develop, again, a valid and credible certification program. We as commissioners don't get to decide what should be on our certification examination. Rather, we conducted a national survey that we had close to 2,500 individuals participate in to help us define the current tasks that interpreters are doing on the job today and the knowledge, skills, and abilities that are required of healthcare interpreters to perform those tasks. And so we've done this through a series of steps. We first brought together, as you can see, I'm on the bottom line here, formed the Job Task Analysis Committee. We identified 10 individuals to represent the depth and breadth of the healthcare interpreting field. And these were folks who represented different geographic areas, different levels of experience, levels of training, different languages, different practice settings. So we had folks not only from hospitals, but clinics and small provider offices and public health settings. We also had folks who represented face-to-face interpreting, as well as over-the-phone interpreting, as well as video interpreting. We brought these folks together for 2 really cold days in Chicago late last year, which helped because they didn't really want to be leaving the hotel when it was about 2 degrees outside. And we asked them to identify the tasks required of healthcare interpreters, and then to identify the knowledge, skills, and abilities that are required to competently do those tasks. And so they did this, and then we developed that information into a draft survey, and we pilot tested that survey. And at the very end of the bottom line there, we actually conducted the job analysis survey. And I'll give you some of the results over the next couple of slides. Once you conduct that survey, you analyze the results, and then you can actually create the certification test blueprint. And the blueprint is the broad outline of what's going to be on the exam, and the exam segmentation, the different categories, and the weighting of the different categories. After we had that test blueprint, we began recruiting additional subject matter experts, again, representing the depth and breadth of the interpreting profession, to work with us on actually developing the items or questions that will appear on the certification exam. And so they worked with us over the last number of months. They developed test specifications. They wrote test items. Then they came back and different members reviewed and approved test items. And all of this is currently happening. And starting the middle of next month in October, we'll actually begin pilot testing these examinations. And after the pilot test period, we bring together more subject matter experts to review the results, analyze the results, and then determine what the appropriate cut score or passing score is. And all of this is done in very close collaboration and coordination with the psychometric experts who literally have decades of experience in developing certification programs. And there's all kinds of scientific and psychometric principles about how to set appropriate cut scores and determine where the passing points are, et cetera. Once the test cut scores are determined, the pilot test will be analyzed and they'll be scored. And then our first group of individuals will receive their credentials by the end of this year. And then in December, we will reopen our application process for testing dates that will begin again in early of 2011. So next slide, please. So let me walk you through the job task analysis and how we developed it and what we found from the results. Again, the purpose of the job task analysis survey is to create the definition of what the healthcare interpreter does on the job today. It's not where we think interpreters should be going in their profession or what we think they should have done or could have done. It's what are they actually doing on the job today. And we had almost 2,500 folks respond, representing interpreting in 141 languages. The results from this survey provided the overall framework for our examinations and also helped establish the blueprint, which I'll walk you through in a couple of slides. So next slide, please. In terms of the response rate, it well exceeded the minimum number that we were required to have for statistically reliable results. We also, by analyzing the data by different subgroups, we were able to document that the blueprint that comes out of this data can accurately test interpreters who work in different modes of interpreting and different practice settings and with different languages. So we found considerable consistency whether folks were performing face-to-face interpreting or over-the-phone interpreting, where they were interpreting in hospitals, clinics, public health settings, etc. And so what we're able to do at the end of this report is construct a valid test blueprint. And for folks who want to see the full results of this report, it's available on CCHI's website, and there really is a wealth of information about how the survey was conducted and then all of the results from the survey as well. So next slide, please. This slide contains the broad overview of our test blueprint. Again, there's more information on our website. But the certification test will actually have two parts. Part one of the examination is 100 questions in English and multiple choice. And this is really documenting someone's knowledge of managing healthcare interpreter functions. And so you can see that there are 5 main categories of questions which will appear on the test. How to manage an interpreting encounter, healthcare terminology, interacting with other professionals, preparing for an interpreting encounter, and the cultural responsiveness. What you can see is also, again, the different weightings of this. So that while it's important, for example, for interpreters to understand different functions of the body and healthcare terminology, we really aren't relying on interpreters to be doctors or nurses. We're relying on them to be able to interpret and be the conduit of information that is provided by a healthcare provider. The second part of the examination is actually testing an interpreter's ability to perform healthcare interpreting. And this is an oral or performance examination. And so candidates who participate in the Part 2 examination will actually be tested on their ability to perform consecutive interpreting and simultaneous interpreting, as well as their ability to perform sight translation and translation. Now this is where you get to some of the struggles and the decisions that CCHI was making, because many of us at CCHI do not believe that interpreters should be called on to translate healthcare documents. And we feel very strongly that there needs to be education in the field and recognition both in healthcare interpreter training programs as well as by the healthcare providers and users of interpreter services that it takes different skills to interpret than it does to translate. However, when we did that national survey, the results showed us that the majority of interpreters are called on to do some translation in the job right now. And so that is why translation will be included on our examination. We are not certifying translators. Many of you know the American Translators Association does have a certification program for translators. But rather, we will be testing interpreters on the basic knowledge of ability to translate basic healthcare information, not long documents, but patient discharge instructions and things like that. A similar question came up actually with simultaneous interpreting, and we had a lot of discussion both within the Commission and with feedback that we were getting from folks outside the Commission about whether or not a healthcare interpreter, excuse me, at an entry level should be called on to perform simultaneous interpreting. And again, we looked to the national data that we gathered through that national survey, and we found the majority of healthcare interpreters are performing simultaneous interpreting. And it usually only comes up in a few situations in healthcare, usually in trauma settings when there isn't time to perform consecutive interpreting, sometimes in mental health settings, sometimes in pediatric settings. So again, based on the national data, it's included on this exam, and you'll see it's weighted somewhat less because we recognize that most healthcare interpreting is done in consecutive mode. Next slide, please. So when we say an entry-level healthcare interpreter, here's what we mean, and here's the definition. The issue, however, is that in most healthcare facilities, they don't have the ability to distinguish when an entry-level healthcare interpreter is assigned to a particular encounter versus an experienced healthcare interpreter. And so even though one may think entry-level only needs some basic information, the reality is in healthcare that an interpreter who is interpreting in a healthcare facility needs to have a wide range of skills from day one that they're going to be performing in an unsupervised way, because they never know if they might get pulled into a higher level experience. And so we base this exam so it is appropriate for someone who's coming into the field with some experience and who's going to be asked to perform interpreting without supervision. Next slide, please. So CCHI will actually be offering 2 credentials later this year. The AHI, or Associate Healthcare Interpreter Credential, is going to be offered for interpreters who interpret in all languages other than Spanish. And this really is an entry point to certification, but it is not equivalent to certification. Candidates for the Associate Healthcare Interpreter Credential will take that Part 1 exam, that 100-question multiple choice English exam, and it will test the basics of knowledge of healthcare interpreting. We won't be able to offer full certification for interpreters in all languages because we can't develop oral performance exams in 300-plus languages. So this offers a baseline so that employers and policymakers and agencies and interpreters can document that they have the requisite knowledge to interpret, but it will still be incumbent on those who want to work with an AHI interpreter to test that individual's actual interpreting skills. So next slide, please. The CCHI credential is the Certified Healthcare Interpreter Credential. And currently this is for Spanish interpreters. And this is for folks who both take and pass that Part 1 English multiple choice exam and also take and pass a 1-hour oral or performance examination. And this is the part of the examination that we actually test the skills and the abilities of interpreting. And so this is a full certification. And so I just want to take that step back and clarify again. What we heard from interpreters and our advisors and lots of folks in the field is that having at least a base certificate of knowledge for interpreters in all languages was important. And so that's why we are offering this interim credential of the Associate Healthcare Interpreter. But we are being very clear with folks who participate as AHI candidates as well as policymakers and healthcare providers that this is not equivalent to full certification. Only someone who has the Certified Healthcare Interpreter credential can be deemed a certified healthcare interpreter. Next slide, please. So this fall, as I mentioned, we are conducting the first administration of the pilot examination for our test. We have close to 400 healthcare interpreters who will be participating with us, and the pilot test will occur between mid-October and early November. And all participants in the pilot examination who pass the exam based on the passing scores that we later set will be granted the credential for which they're eligible, so either the Certified Healthcare Interpreter or the Associate Healthcare Interpreter credential. Next slide, please. We've all learned quite a bit about what it takes to develop a certification program in a valid and credible way. There's also a lot still to be learned by all of us. And so we've created a section on our website called Myths and Truths, because we've seen a lot of folks who are confused about this process and what does certification mean, how can you get accredited, is it certification or a certificate, what does vendor neutral mean, and we've tried to address these on our website. So I do encourage folks to take a look at our website, really explore it, and if you have further questions, to please send them to us, because we do try to keep answering them and keep this information out. We also do encourage your feedback generally, because as I said, this is a process that we want to be responsive to all who will benefit from it. And so while we've involved thousands of folks already, we'd love to have thousands more participate with us. So next slide, please. So just in wrapping up, I do encourage you all to get involved in the CCHI community, to talk to us, to involve us in your conversations, involve us in getting feedback from you. Join our mailing list. We send out a monthly update with new information about where we are in the development process, all of our upcoming speaking engagements, so folks can come and actually meet commissioners and representatives in person. And we also encourage you to become a supporter of the development of our program. So next slide, please. So just in closing, I hope I've given you a good overview of what led to the development of CCHI, who's involved, why we're involved, and to really encourage you to get to know us more and to become involved. We need your leadership and commitment for this to succeed, and we want to work with all of you to ensure that we're developing the credentialing program that meets all of the needs of the stakeholders in this field. We do have a webinar coming up on Friday. I'm sorry, next slide. This webinar is going to go a little bit more in depth into actually developing the test and walk you through the process of how we recruited our subject matter experts and what the item writing workshops were involved. I know it's pretty close to this one, but it is this it is this Friday, and you can sign up on our website. We also will archive it, so if you're unable to make it this Friday, you can come back later and listen to a recorded version. And then again, we have another webinar coming up on December 3rd, which is really about getting ready for certification for folks who will be looking to apply and then test in early 2011. And so just the next slide, and I look forward to answering your questions.
Great. Thank you so much, Mara. That was a terrific presentation, and I think gives us a really good overview of the process and the people behind the process and how things are going to roll out. So we have a number of questions, and I'd like to start throwing them out to you. The first one that I'd like to start with, I think is quite interesting. Somebody says that their organization uses quite a number of native Spanish speakers who currently serve as interpreters. Do you recommend certification for somebody who is a native bilingual professional who may be acting as an interpreter as opposed to actually being hired as an interpreter?
Sure. I think that really is a question that is going to depend on each organization or entity. Our program was certainly developed for interpreters. So if you have native speakers who are providing services directly in Spanish, is this program appropriate? No. If you have native speakers who are sometimes providing services directly in Spanish but sometimes interpreting for other clinicians or staff, then this could be appropriate. CCHI believes that the rollout and implementation of certification is going to be a process. And it should be a process that takes some time because this is new for all of us. And it's going to take time for folks to understand the benefits of certification, understand what it takes to be certified and to go through the process and actually participate in the exam. So we certainly encourage folks to take a look at this and see if it is right for them. And we fully expect that as the years progress that more and more employers or agencies or even states might make certification mandatory. But I think in general for you, if you're evaluating it for yourself or your organization, the question is having a competency-based assessment something that will benefit your organization? Is it a way to help with accreditation standards? Is it a way to help document your folks are actually competent for other needs or risk management? Or is it a way to help really document that only folks who have a certain competency level should be interpreting? And this goes back to sort of my work broadly on language access at the National Health Law Program. I think we've all heard, too many stories of where family members, friends, or untrained bilingual folks are pulled in to interpret and don't have the requisite skills. And so having a competency-based assessment really can help document that there are certain skills and abilities that are needed by interpreters, and we need to recognize that and compensate for it.
Okay. Just as Mara finished her presentation, we got a deluge of questions, so I haven't even actually been able to read them all. They've come in so quickly. So I'm going to do my best to move through some of these. One question that gets posed is, when will certified healthcare interpreter credentials be recognized at the national level? And is this credential, or will this credential be recognized at the same level of other healthcare credentials such as nurse licensing?
That's a great question, and it's really not something that CCHI can predict. What we've seen from evidence in the development of other new certification programs is over a period of time, whether it's 3 to 5 or 5 to 7 years, you do certainly see greater recognition of the need to have that credential or certification. We've all obviously just seen healthcare reform move forward. There were not requirements for credentialed interpreters in healthcare reform. The likelihood of Congress having any appetite to do any more work on health in general over the next couple of years sort of remains an open question. But I think in general we may see more development at the employer or organizational level, implementing requirements or expectations for certification, and then often you start to see some states implementing state laws requiring licenses for interpreters, and as a prerequisite for a state license to impose requirements for certification.
Okay. Another question, a series of questions here that are more related to the actual certification test itself. One of the questions is, what are the prerequisites for certification? And then can you tell us a little bit about what the fee will be for the test, and whether there's a difference between this test and the certificate of knowledge?
Sure. Okay, let me start with the first, which is prerequisites. The current prerequisites is that an individual must be 18 years of age or older, have a high school diploma or its equivalent, have completed 40 hours of healthcare interpreter training. And we wanted to be clear here that someone who completes a court interpreter training or translator training, that's not the same. There is going to be some overlap, but we wanted to make sure that folks were completing training related to healthcare interpreting and really were familiar with the ethics and standards of practice and terminology that is used in healthcare interpreting. We also required that interpreters have language proficiency both in English and in the language in which they interpret, and also have at least 1 year of experience in interpreting in healthcare. And that last requirement must actually be verified by a letter signed by the person's employer or an agency they've worked with or an organization they volunteered with. In terms of fees, we still are determining the fees for test administration to begin in 2011. And we're in the process of talking with a number of potential test delivery vendors. And I just realistically, I do not know the answer to that yet. We are very conscious of the costs related to certification, and particularly for interpreters who may interpret in what can be called languages of limited diffusion or languages of lesser diffusion, and may not have opportunities in the same way that Spanish interpreters, or depending on what area of the country, sort of an interpreter in a more major language would have. And so when you start having requirements for training and the costs associated with that, plus certification, we're very cognizant that we don't want to be pricing folks out of a credential when they have the actual knowledge, skills, and abilities that you want. So we're trying really hard to keep the cost as low as possible. On the other hand, you do have to recognize that we do have to pay a test delivery vendor to administer the test. And for the Spanish interpreters for whom there's that oral performance exam, they actually also have to be scored by 2 independent individuals. And so we have to pay those folks for their time and energy. The other thing I just should mention is that while we only have the Spanish oral exam right now, We will be developing it in other languages over the coming years, and we would love to be working with folks to identify what are the most important next set of languages and identifying new subject matter experts to help participate in that. And the last question, I'm sorry, it was on, the different credentials. The interpreters in all languages other than Spanish will take the 100-question multiple-choice exam, and if they pass it, they will be granted the Certificate of Knowledge of an Associate Healthcare Interpreter. Folks who participate in, who want to get the full certification will first take that 100 multiple-choice exam. So that 100-question multiple-choice exam is taken by all interpreters. And then Spanish interpreters, for whom we currently have the oral performance exam, will go on and take the second part of our exam as well. So there's a base exam in English for all interpreters, and then the performance exam currently in Spanish, but which will be developed in other languages.
Great. We have a question about how does an interpreter prepare for the complete certification exam? How does a trainer prepare training materials for the test? And will the test be online or in person?
Let me start with the latter. The test will be at a computer. It's a computer-based examination, and it will certainly be available at test centers available nationwide. That's part of what we're exploring is different options that we have available. Oh, I'm sorry. I just forgot on the first part of the question.
That's okay. How does an interpreter prepare?
Oh, how does
for the
someone
complete
prepare?
exam, and how does a trainer prepare?
Sure. For an interpreter preparing for the exam, the best thing to do is take a look at that National Job Task Analysis report and be very familiar with that blueprint. I gave you the baseline of the blueprint as one of the slides, but there's a lot more detail in that report and a lot more information about the types of questions and content areas that will be covered. We also suggest that interpreters are familiar with excuse me, the National Code of Ethics, the National Standards of Practice, which are both available from the National Council on Interpreting in Healthcare, as well as the Standards of Practice from the California Healthcare Interpreters Association and the International Medical Interpreters Association. In addition, for the participants in our first administration this fall, we're finalizing a candidate's handbook, which will be available by the end of the month, and it also will include some sample questions from that English multiple choice exam, so folks will have a basic idea of what they'll be looking at on the exam. So we will be providing as much information in advance as possible to folks, and we also give some other guidelines in this candidate's guide about how to study. And that certainly will be available in a much more extensive form in December for folks applying to start testing in 2011.
Okay, great. We have a question here about what plans CCHI has to make this a dynamic exam to avoid creating a dinosaur. This questioner points out that there's a lot of research going on to better understand the interpreting process and how interpreters should be tested and assessed, and that information may change the situation with regards to testing and certification over time. Anything that you can tell us about that, that particular dynamic and how CCHI might address that over time?
Sure, and actually I want to start off by mentioning something I should have also said in response to the last question. In regards to how can trainers prepare folks for the exam, again, I think it's looking at our national survey results and the content areas on the exam, but also to know the National Council on Interpreting in Healthcare is currently developing national standards for training for healthcare interpreters. And this is something that CCHI looks to with great interest because we don't currently have national standards. And I think that those will be a really strong complement for the work of CCHI, and that you likely will also start to see some more standardization of training of healthcare interpreters and recognizing what should be included in training programs, both to train interpreters generally for the job, but also to help them prepare for certification. In terms of making this dynamic examination, this is part of the work of a certification commission, that we don't just develop an exam, release it, and say our work is done. It never is. We are going to constantly be monitoring both Part 1 and Part 2 of the examination to evaluate how individuals are performing on both parts. We will be constantly developing and then pilot testing new questions for the examination so that as you see development in the field, some questions may just become obsolete. You may also start seeing new areas of development. I don't think many of us could have predicted 5 or 6 years ago the strong emphasis on emergency preparedness and how that affects the role of an interpreter and the knowledge that they must have. So we constantly will be monitoring the exam. It's very sort of recognized that certification programs also will conduct updates to their job task analysis. So we can go back to where I spoke a little bit about translation, whereas we don't really feel interpreters should be called on to do translation. Well, if there is education and movement in the field such that the majority of interpreters in 5 years are no longer asked to translate, that's an area that would come off the exam. And then you have to evaluate, is something substituting, or is the exam just becoming weighted in different ways? So this certainly is a constantly evolving process and one that CCHI is committed to for the long run, and really looking forward at working with all of the folks participating with us and in the field to make sure that it does continue to be evolving to meet the needs of healthcare interpreters as they proceed through their careers, and also healthcare providers, so that it doesn't become stagnant.
Great. Now, we have a number of questions here from people who are wondering about training and the sort of basic training that one would need to undergo before sitting for the certification exam. Can you talk a little bit about what some of the options are? Because it did sound as though you were not saying that there was a particular training program that you felt people needed to follow, but I think that a number of audience members have questions about where they can go to find out about trainings and any advice you might have on that.
Sure. CCHI does not endorse any particular training programs, and we do not offer training ourselves because in part that would be a conflict of interest for a certification program to train folks to take its own exam. The prerequisite as it now stands does say 40 hours of healthcare interpreter training, and there are a variety of training programs out there both in the academic and the non-academic setting that are at least 40 hours. Again, we would hope that folks would take a look at that National Job Task Analysis report to see the content areas that will be on certification. And when they're examining training programs, see if the training program is training students around those subjects. So while I can't tell you exactly the healthcare terminology that will be on our exam, folks should be looking for a training program that is going to be helping them expand their knowledge of healthcare terminology, ethics, standards of practice. In addition, I think as you see the development and movement towards the national standards of training that I mentioned from the National Council on Interpreting in Healthcare, we may see, again, more of a recognition by certification programs that a training program must meet these basic standards. But again, we don't have those standards yet, so again, it's sort of an evolving process. In addition to actually participating in a formal training program, we also do recognize that folks may be getting experience in healthcare interpreter training in other ways. So other things that can count towards that 40-hour prerequisite is attendance at professional conferences where issues related to healthcare interpreting are discussed. If interpreters are actually conducting their own trainings of other healthcare interpreters. If they actually are doing on-the-job supervision. So we've heard from a number of hospitals that their new interpreters are actually shadowed and mentored by experienced interpreters for the first month or two. And so again, that would count. So there are a variety of ways that folks can meet this requirement, and we're happy to answer specific questions from individuals via email or phone calls as well.
Okay, Mara, we're coming up on 1 minute before the hour, and I still have a pile of questions here. But what I was going to suggest was that if you had a few more minutes, we could keep going with some more questions. And then, as I said before, we will also be sending you the list of questions, which we would invite you to answer as many of them as you can, and then we'll be posting those up on our website. So what's it look like for you? Do you have a few more minutes?
I'm absolutely happy to spend a few more minutes, and if folks have to get off the phone because of other commitments, I do just encourage you to shoot us an email. You can send an email to info@healthcareinterpretercertification.org. and those come to my mailbox, but I'm happy to spend some time now answering some additional questions.
Okay, terrific. We have a question here, well, a statement and a question. American Translator Association accreditation is valid only while the association member is a member in good standing of the ATA. Will CCHI certification require membership as well? And can you talk about the potential for requiring continuing education in order to maintain certification?
Sure. CCHI is not set up as a membership organization. While many certification programs that have been around for a long time, like the American Translators Association, have a different model, the sort of current theories behind certification programs is that they actually should not be membership organizations or a traditional charitable organization as recognized by the IRS. So actually we are not a membership organization, and we will not require membership in CCHI as a condition of continuing one's credential or certification. That said, in order to comply with the national standards for accreditation of certification programs, our certification must be time limited, and so it's likely that there will be a time limit on it. We haven't decided that yet. And there also will be requirements for continuing education. Again, we haven't set the exact parameters for that. We do expect to have that by the end of the year. But I think it's important for all of us to recognize that if we are looking for the type of recognition of the profession of healthcare interpreting, as someone mentioned earlier, as for nurses or other radiology technicians or others in the allied health fields, we also have to recognize that with that right to have a profession comes the responsibility of continuing to maintain the knowledge, skills, and abilities required. And so that is where continuing education comes in. So yes, there will be a requirement to maintain one's credential to complete a certain number of continuing education courses and hours. And I encourage you to sign up on our mailing list, and as soon as the information is available, we will make sure our folks on the mailing list receive it.
Okay, a question here about how frequently one would need to take the certification exam. Is this something that one only does once? Is it permanent? Do you have to be recertified? How often, if so?
This sort of builds on the last question. For most certification programs, there is not a requirement to retest if someone has complied with the requirements for renewing their credential. So if an individual obtains their credential through CCHI, complies with the requirements for continuing education, reports that to CCHI as required, it is likely that their credential will be continued for another period of time. If someone lets their credential lapse, then usually the requirements are that someone retest.
Okay. Let's see here. I'm sorry. While I'm listening to you answer your questions, I'm also scrolling through all of the questions that we're receiving. So be patient with me just a second here. Here's a question that I'm sure is on the mind.
Well,
go ahead. Mara?
Yes, go ahead, Julia. Sorry.
Okay, that's all right. So here's a question that I'm sure is on the minds of many people who have been interested in the webinar series. Can you say how the CCHI certification process and test differs from the medical certification that has been developed by the National Board of Certification for Medical Interpreters?
Sure. Many folks know that there are two organizations that are offering healthcare interpreter certification. I do encourage folks to take a look and to become educated about both. I think the main differences that you will see at this time is that CCHI is offering the Certificate of Knowledge to interpreters of all languages, while the National Board is only offering full certification for Spanish interpreters. I also think that there are significant differences in the content areas of the test. And so folks should take a look and get information on next week's webinar that will be presented by the National Board folks about the content areas of the test. And you've seen what I've given you, and I think the National Board differs in the presentations I've heard that they give. About 75% of their multiple choice exam focuses on healthcare terminology. And so I think you need to do the research and to look at the information yourselves. On CCHI's website, we did post some history and some background as to the development of both CCHI and other efforts at certification. So if you go to CCHI's website, which is www.healthcareinterpretercertification.org, under the, I think it's the About Us tab, there's another drop-down tab called History. And so take a look at that, and you'll get some of the background information as to what's been put out and presented by other individuals, entities, and by our organizations about the differences between the two.
Great. A question about certification. I would say it sounds to me like the question is about the value to both interpreters as well as healthcare organizations of engaging in the certification process in light of the fact that certification is not necessarily accepted or required on a national level just yet. So given that we're sort of in an emerging place in the field, I think the question that a lot of interpreters have on their minds is, why should we do this?
Well, I think there's a couple reasons. I think for interpreters in particular, it really helps document their knowledge, skills, and abilities. And whether it's the Certificate of Knowledge or the Spanish certification, what we believe certification does is it offers interpreters a way to show that they actually have the qualities that employers and agencies are looking for. Because too often, folks have sort of relied on the word of mouth or the independent assessments or other ways that really don't document competency. And so while it's newly emerging now, I think in 6 months to a year, you certainly are going to see greater recognition by all participants in healthcare of the benefits of certification. And so I think the early adopters will shine through later because they'll have helped their folks navigate this process, understand it, and participate it. And for language agencies or vendors of language services, I think it also can be a business advantage. Again, as a way to help document for purchasers of language services of the quality of the interpreters who are working with them. And for healthcare providers, it can help with accreditation. It can help with risk management issues. It can also help, again, as sort of a marketing tool to document that this hospital or clinic or doctor's office cares enough about the effective communication that they're willing to put in the resources needed to have their interpreters become professionals and recognized as professionals through a valid and credible certification program.
Great. I actually think that that's a really nice point for us to end on. So I'd like to thank Mara for giving this presentation to us today and for getting us started on this topic of interpretation certification for people who work in healthcare. I'd also like to thank all of you in the audience for all of your terrific questions. As I said, we will be submitting this complete list of questions to Mara. I actually think that she'll find it very interesting so that she can use this information to address some of the concerns out in the field, but we will also be posting the answers to these questions that she gives us on our website. So again, on our website you will have the slides that she presented today in the presentation. Within a week, we will have a complete audiovisual recording of this webinar. We'll be sending you a satisfaction survey so that we know how we're doing in terms of our webinar offerings. And we will have the second webinar in this series on Monday, September 20th, which will feature the National Board of Certification for Medical Interpreters, how to prepare for and take our certification exams. So again, thank you very much for your participation. Thank you again, Mara, and we look forward to seeing you on the next webinar.
Thank you very much.